right, so exogenous Cushing. So there's a paradox. Steroids treat autoimmune conditions, but too much of a steroid can also cause problems in your body. So if you have a woman who has lupus, she's likely received chronic glucocorticoid therapy, then her symptoms will be muscle weakness, bruising, and hyperglycemia. This is all classic for exogenous Cushing syndrome. And so, what's happened to her adrenal glands? Well, if you have a patient with long-term prednisone for autoimmune diseases dies, then an autopsy would show a bilateral atrophy of the zona fascicularis. GFR is the way you should think of with the adrenal glands here. So the long-term glucocorticoids are going to suppress the HPA axis, causing low ACTH and then adrenal atrophy. Only endogenous cortisol production will shut down and aldosterone production continues due to the RAS control. So, external steroids, what they do is they shut down that hypothalamic pituitary adrenal axis. ACTH is going to plummet, and without that trophic signal, the zona fasciculata and the reticularis are just going to atrophy. Only the zona glomerulosa is going to stay active, and that's just thanks to angiotensin 2. All right, so if you see a steroid user with Cushing signs, then the autopsy is going to show shrunken adrenal cortices. The zona glomerulosa is the salt keeper of the adrenal cortex, right? So think of it as salt, sugar, sex. They say as you go deeper, it gets sweeter. Adrenal cortex layers from the outer to inner. Glomerulosa is salt, fasciculata is sugar, and then reticularis is sex, GFR, just like the kidney filtration. And so mineral corticoids like aldosterone are going to be produced there. We're speaking now of the glomerulosa. So mineral corticoids like aldosterone regulating the sodium reabsorption, potassium secretion, and also blood pressure. Regulation, it's not going to be regulated by your ACTH. Instead, it's controlled by the RAS system, right? Not ACTH, the RAS system. Okay, that's really important to know about the glomerulosa. And so hyperaldosteronism could be related to the zona glomerulosa, that's Conn syndrome. And 21-hydroxylase deficiency is decreased aldosterone and cortisol. And Addison's as well is a deconstruction or destruction of the adrenal cortex, causing decreased aldosterone and therefore hypotension and hyperkalemia. So yeah, the glomerulosa is like the thinnest layer of the adrenal cortex, but it's super important for blood pressure. Yeah, that's kind of a deep dive into this little subject. Basically, we got the SLE, chronic glucocorticoids. This causes hypercortisol Cushingoid symptoms, osteonecrosis, and sudden cardiac death from atherosclerosis. And the reason why is because these steroids will decrease your CRH, which decreases your ACTH, which then causes all those hormones in the adrenals to then start to, you'll experience atrophy of your adrenals in the zona fasciculata and the reticularis. So it'll be bilateral, right? It's hypercortisolism, iatrogenic Cushing syndrome from glucocorticoid suppression of the HPA axis. Leads to adrenocortical atrophy, zona fasciculata, and reticularis are going to be atrophic. Okay, that's all there is to this one. We'll see you in the next video.